And all these are the premises, that firstly, the hospital is a manufacturer. Another thing that on which 3D printing is premised upon is that imaging services must support virtual surgical planning and 3D printing. And the third is, of course, 3D printing must deliver ROI in terms of return of investment to the hospital. I'll talk a bit about all these points. So really, the hospital is a manufacturer, and in where we're from in Singapore, it always has been a manufacturer, whether we like it or not. This is a picture of us with the dental center next door. They've been producing splints, guides, and household for really many years. We've got a radiopharmaceutical team in the hospital that actually produces Technetium 99 on site for our, and they're actually manufacturing standards to do so. In addition, we've got a prosthetics and orthotics lab that actually manufactures a lot of their orthotics and so on and so forth. So these are the thing that we realize is that the hospital is a manufacturer, and with the manufacturer, imaging services then need to move to kind of support the VSP and 3D printing work that goes along with it. So these are models of surgical guides, of surgical models and guides. But behind making this, actually, one needs to go back to the radiology, and one needs to look at really how the images are created, both from MRI on the left and on CT on the right. The third is that if we're considering ROI, we have to talk about metrics. How does a hospital then consider that your service you're providing gives a return of investment to the hospital? This can happen in a few ways, and these are just broad categories of concern. How do you bill for goods and services? Do you get money? Does hospital get reimbursement for what's done? Secondly, does it bring down operative time, and in so doing, increase the number of operations that can be done? The third thing is does 3D printing actually enable complex treatment that you couldn't do before, such as in this case, where we've got a patient with a very complex spinal reconstruction near a lot of vessels, in which without 3D printing, the operation will be a bit more difficult. Or fourth, are you able to kind of to decrease the delivery times of otherwise very difficult to obtain materials by 3D printing them in-house? So I think these are the certain metrics that we need to look for in clinical 3D printing. And in our hospital, what we do is that there are many different parts to 3D printing, ranging from machine parts, medical education, dentistry. We focus on surgical models, guides, appliances, and implants. I'll talk a bit more about those. So these are just kind of examples of what 3D printing can be used for. One of them is surgical models for rehearsal. So in patients, say, without an external ear cavity, what we can do with 3D printing is that you're able to kind of virtually plan where you want to create the new ear cavity for the patient, practice with the surgeon's ways to simulate the surgery so that the surgery itself becomes more accurate. For implant sizing models, you can take the same models and then you use them to size your implants too. So this is an orbital fracture, fracture here simulated. The treatment for this is to put a plate in. The trouble with putting the plate in is that you're very close to very important structures, such as the back of your optic nerve. You don't want to injure that. So really being able to shape the plates beforehand brings a lot of benefit to the operation.